The Dr. Ameyo Stella Adadevoh Health Trust, or DRASA for short as we call ourselves, we're an NGO established in October 2015 here in Nigeria, and we were founded in memory of the doctor who was involved in helping stop the spread of Ebola in Nigeria. And our focus is all about preparedness. It's all about strengthening Nigeria's healthcare system to make sure that if another infectious disease outbreak happens, it doesn't turn into a situation like what happened in Liberia, Sierra Leone, and Guinea during the time of Ebola. But we're not just focused on Ebola, we're focused on all infections, all viruses and bacteria, from cholera to Zika virus to yellow fever, all of the things that spread from person to person, from animals to people, and so on. We can't do it alone, all the things that we want to do. So we've partnered with some international organizations. We have University of Pennsylvania and Partners in Health. So they've come from Liberia and the US to Nigeria here in Lagos for a 5-day scoping visit. And the goal of the scoping visit is to connect our international partners with our local partners here on the ground, for them to come and understand and see firsthand all the challenges and gaps in the health sector so that we can collectively design solutions to assist and strengthen the healthcare system. During the scoping visit, we did a lot. On the first day, we had 2 site visits. The first was in Ogun State, Babcock University. We were able to take them around so they could see the campus, understand how the students are educated, understand the level of training that's provided, and also see the gaps and the needs. That same day, we also went to the First Consultants Medical Center, and that was a very significant visit. That's the hospital where Dr. Adadevoh worked for 20 years. That was the hospital where the Liberian man with Ebola arrived. That was the place he was first treated, and that was also where he died. And it was the center of the response in 2014. On the second day, we conducted 3 site visits. We went to 2 public hospitals and 1 private hospital. In each of the hospitals, we were able to meet with the chief medical directors and their staff and understand what policies and procedures they have in place as of now should an infectious patient walk into their doors. The most striking visit for that day was Mainland Hospital, which is the infectious disease hospital here in Lagos State, which is the site where all the Ebola patients were eventually taken in 2014. And it's the place where if we have another outbreak, everybody will be taken. It's the center of infectious disease treatment and isolation in Lagos.
We have viewed several different types of hospitals and several different levels of care. We know that the system is not perfect. We know that there are lots of challenges. We're here as part of a bigger scoping visit. And I think through the partnership with DRASA, there are many ways that we can help address some of those gaps and support DRASA at empowering the health system and addressing infection control in general to make sure that we're able to outsmart future epidemics.
As we've been talking about education and training and policies, revisions, advocacy, is there anything that you would say would be off limits to DRASA?
On day 3, we hosted a working session because we wanted to engage people from all aspects of the health sector. And together we were able to sit down and discuss everything we had seen. We were able to share with them our observations, understand their challenges, understand what they need. And together we were able to come up with a plan to move forward.
You can't even begin to identify an outbreak without having data to tell you that something has changed. Data is necessary to evaluate whether or not any sort of interventions you have put into place are having an impact at all. And definitely data is essential that once you've found interventions that work, to make sure those interventions remain in place, are closely monitored and evaluated for ongoing success.
I would probably say act at the 3 levels: policy, health facility, and community, and make sure that they are integrated. Leverage the resources and expertise that are available, not only in the public sector, but in the private sector and international community. Have a very deliberate and strategic approach to how you pilot an intervention, you scale it up, and you evaluate its effectiveness. And I can be a little more specific, but I think those are the three things that I would recommend.
So after the working session, we did a site visit to a public hospital, one of the biggest in Lagos States. They're actually under renovation right now, so it was interesting to see how they're developing their infrastructure and improving, and yet they still have challenges and they still have needs. And to end the visit, we held an event, mostly for people in the health sector, although it was open to the public. We had 6 panelists representing everything from government to pharmaceuticals to private health sector, public health sector, and even the World Bank.
What we can, as a system, provide is to prevent the outbreak turning into pandemics.
Having this kind of forum is very essential, but to me, there were lessons to learn for the sector. One of that is that we have a fragile health system, and it's incumbent on every one of us to see what we can do to develop that system.
During the panel, we examined the cost to private sector businesses, both financial and human resources, when disease outbreaks occur. We also discussed the need for public health strategies and laws that would help us to prepare for outbreaks.
Can we build an ecosystem of investment and investors who can really make a difference across the value chain?
We need to work again with the media to make sure that we provide correct information.
The same man who is not ready to go to the hospital and spend, let's say, about 2,000 or 3,000 naira on his head, if it happened that his wife delivered a baby tomorrow, somehow he will find money to celebrate, call people, let them drink beer and all sorts of things. So that's what I call the poverty of the spirit.
Most refreshing to those of us from the United States, there's a openness and frankness of discussion, just as you've heard in the panel today, and particularly from our last speaker. This is just critically refreshing, one, but also really, really important to moving forward, because you have to acknowledge where, what needs to be attacked and addressed if you're going to move forward. So you don't want to be, pushing to the side the fundamental problems and just pretending that things are okay.
There were so many takeaways from the scoping visit, so many things that need to be done and so many lessons to learn. One of the biggest gaps that was made very clear to us is the education and training gap, not just for people who are operating in the health sector, but even for the public, the general public. In addition to that, there's gaps within the health sector. So for doctors and nurses and medical officers and everybody who's working in hospitals and clinics across the country, there are gaps. Another opportunity we identified is the need for work within the policy and advocacy area, ensuring that policies are reviewed in a timely way, ensuring that communication of new and updated policies is efficient and effective to reach all levels of the health sector, from the ministry all the way down to your local facility.
There's a recognition that the challenge is huge, but that we can start to work on very concrete deliverables, whether it's in the short term, the medium term, and the long term. And I think if we break it down in that way, the situation and the challenge will not appear to be insurmountable as it would if you just took the whole collective challenges all at once and try to tackle it. So I think just taking small chunks at a time where you can make a difference and ensure an impact. I think this is the first step towards achieving your goals. First of all, admitting that there is a problem, talking about the problem, and also being eager to co-create solutions with others. I think those are some of the key takeaways for me from the panel discussion today.
The goal of this visit was to really define sort of the scope of the problem, to define what exactly we want to focus on and how it aligns with DRASA's mission and goals. I think we've really done that. If anything, I think we've really set a very ambitious agenda, but I think I'm confident that we'll be able to work together both with our experts at the University of Pennsylvania as well as our experts who have lots of field experience in West Africa and all over the continent with Partners in Health to put together a training program that is very impactful and that can really have an impact, just make an impact on everyone's lives. And I think that's really the goal that DRASA has set is, it starts with me and that we can all make a difference. And I'm very excited to continue working together with them and hope I'll have a chance to come back to Lagos again soon. It's been an amazing experience.